Today's subject is Pharmaceutics 2 and chapter number 3 is Posology, and in this lecture we are going to see the question answer session of chapter number 3, that is Posology. These are the frequently asked question in session as the annual examination. For example, the question number 1 is define posology and enlist the factors affecting dose of drug. This question is asked for 2 marks. In this question we have to write first definition and second enlist the factors. Then what is the definition of posology? Posology is a branch of medical science which deals with the dose or quantity of drug which can be administered to the patient to get the desired pharmacological action. It is called as posology. And second, we have to enlist the factors affecting dose of drug. There are total 16 factors. The first factor is age, then sex, then body weight, then route of administration, then time of administration, then environmental factor, then emotional factor, then accumulation, presence of disease, then additive effect, then synergism, then idiosyncrasy, then tolerance, then tachyphylaxis, and last is metabolic disturbances. These are total 16 factors. These are affecting the dose of drug. This question is asked for 2 marks. And the question number 2 is write Young's, Dilling's, Fried's, Clark's, and body surface area formulas along with their significance. Then each formula is asked for 2 marks. Then we have to see one by one. In this question, this Young's formula, Dilling's formula, and Fried's formula are used to calculate the dose of drug according to age group. And the second, this Clark's formula is calculated according to the body weight. And third, this formula is calculated according to the body surface area in meters square when it is given. Then one by one, we have to see the first Young's formula. Young's formula equals to child dose equals to 18 years upon 18 years plus 12 into adult dose. And what is the significance of this formula? This formula is used to calculate the age of a child up to 12 years of old, means 2 years to 12 years of old. Then second, it is Dilling's formula. Dilling's formula equals to child dose equal to 18 years upon 20 into adult dose. And what is the significance of this Dilling's formula? This Dilling's formula is calculate the child age in between 4 to 20 years. This is the significance. And third is the Fried's formula. Fried's formula, child dose equals to aging month divided by 150 into adult dose. And what is the significance? And when it is applied, the Fried's formula? Fried's formula is applied when the age of child up to 2 years of old. Then next is the Clark's formula. Clark's formula is used to calculate the dose of drug according to body weight. Then in first Clark's formula, when the weight is given in kg. Then we have to apply the Clark's formula. Child dose equals to weight is given in kg divided by 70 into adult dose. When weight is given in kg, it is divided by 70. And second, in this, when weight is given in lb or pounds, when the formula is child dose equals to weight in given lb or pounds divided by 150 into adult dose. Then what is the significance of Clark's formula? This formula is used according to calculation according to the body weight. And when weight given in kg, it is divided by 70, and weight given in pounds, it is divided by 150. And last is the formula for body surface area in meter square. Then child dose equals to, then the formula is child dose equal to body surface area of child divided by body surface area of adult into adult dose. And in this, the body surface area of adult is 1.73 meter square. It is the standard. Then formula is child dose equals to body surface area of child in meter square divided by 1.73 meter square into adult dose. And this formula is used when the body surface is according to body surface area calculation. The dose is calculated. So in this question, each formula is asked for 2 marks. 1 mark for formula and 1 mark for significance. So these are the formulas calculated according to age group, according to body weight, and according to body surface area. And next question is question number 3. That is define posology and explain synergism, antagonism, idiosyncrasy, tolerance and tachyphylaxis with suitable examples. These are some factors which are very important for factors affecting dose of drug. These factors are very important. Then in this question is explained, asked for 3 marks, and we have to explain any 3 factors, 1 marks each, along with their examples. You have to first define the posology, and one by one we have to explain these factors along with their example. For example, synergism. Synergism means when 2 drugs are given in combination, the action of one drug is enhanced, means increase the other drug. It is called as synergism. The example is procaine and adrenaline. When procaine is given along with the adrenaline, the action of procaine is increased. Then second is antagonism. Antagonism means opposite. When 2 drugs are given in combination, one drug can oppose the action of other drug. It is called as antagonism. In this, the simple example is milk of magnesia is given in acid poisoning, which oppose the action of acid poisoning. And second example is acetylcholine and adrenaline. When given in combination, one drug can utilize the action of other drug due to the opposite action. Then next is idiosyncrasy. Idiosyncrasy means simple called as it is termed as allergy. Means an extraordinary effect is observed. It is other than the characteristic pharmacological action. It is simple called as the allergy. It is called as idiosyncrasy. And we have to give one example of idiosyncrasy. Then next is the tolerance. Tolerance means what? The large dose of drug is required to give the pharmacological action than the normal. It is simply called as the tolerance. Then we have to do the one example of tolerance. Then next is tachyphylaxis. What is tachyphylaxis? When in certain conditions the drugs are repeatedly given at the short intervals, the cell receptors get blocked and the pharmacological action of drug is decreased, and this action is not increased if you have to increase the dose of drug. It is called as tachyphylaxis. The simple example is ephedrine. Ephedrine given the bronchial asthma, if it is repeatedly administered, the dose of drug is decreased. In case of if you repeatedly administer, then this is the question asked for the 3 marks. Then next is last question is write the formula for calculation of doses on the basis of age, body weight and body surface area. This is important question and asked for 3 marks. Then in previous question we have to see the formulas. Then in this question we have to write the formulas for age. Then calculation according to age. The formula is first formula is Young's formula, second formula is Daly's formula, and third formula is Fright's formula. Then second, calculation of doses proportionate to body weight. Then you have to write the Clark's formula. And last is the calculation of doses according to body surface area. Then you have to write the body surface area formula and according to give the calculation of doses. Then in this lecture we have to see the question answer session, which is important for annual as well as sessional examination. And these are very important questions of the chapter number 3 is Posology.